In this video, we're going to explore 10 crucial signs of mental health issues that you should never ignore. It's essential to recognize these signs, not just for yourself, but also for those you care about. Your mental well-being is a priority, and by watching this video, you're taking an important step in understanding and prioritizing your mental health. Remember, you're not alone on this journey, and there's help and support available. If you find the information in this video valuable, don't hesitate to show your support by liking, sharing, and subscribing. Let's start with the first sign: persistent sadness or prolonged low mood. This isn't just feeling down occasionally, it's a lingering feeling of unhappiness that doesn't seem to lift, even when things are going well. Imagine waking up day after day with a heavy heart, finding it hard to enjoy activities you once loved, or feeling like a gray cloud follows you everywhere. Maybe you're struggling to find joy in spending time with loved ones or engaging in hobbies you used to be passionate about. Recognizing persistent sadness is crucial because it's often a key symptom of depression, which is a treatable condition. Ignoring this sign could lead to further emotional distress and affect your overall quality of life. But understanding it and seeking help can be the first step towards feeling better and reclaiming your happiness. Moving on to the second sign: excessive worry or anxiety. This means more than the usual concerns we all have. It's an overwhelming and constant feeling of unease. You might find yourself worrying about everything, even the smallest of things, to the point where it's hard to control. Anxiety doesn't just affect your thoughts and emotions, it can also manifest physically. You might experience symptoms like a racing heart, shortness of breath, sweating, trembling, or even stomach discomfort. The impact of excessive worry or anxiety on daily life can be profound. It can interfere with your ability to concentrate at work or school, make decisions, and enjoy social activities. It might lead to avoidance behavior, where you avoid situations that trigger anxiety, which can limit your experiences and opportunities. Sign number 3: sudden mood swings. This refers to dramatic shifts in your emotions that happen quickly and often without an obvious trigger. For example, you might go from feeling extremely happy and energetic one moment to deeply sad or irritable the next. Bipolar disorder is one condition characterized by these mood swings. In bipolar disorder, individuals experience manic episodes of high energy and elation followed by depressive episodes of intense sadness. These rapid mood swings can be challenging for both the person experiencing them and those around them. It can strain relationships and make it difficult to maintain stability in life, such as holding down a job or managing daily responsibilities. Moving on to sign number 4: social withdrawal. This involves a significant change in social behavior. You might notice someone pulling away from friends and family, canceling plans, or avoiding social gatherings they once enjoyed. 1. Social withdrawal can be a sign of various mental health conditions, including depression, social anxiety, or even the early stages of conditions like schizophrenia. 1. It's a way that individuals cope with their inner struggles. 2. While it's crucial to respect someone's need for space, it's equally important to encourage and support them in staying connected. 1. Isolation can worsen mental health challenges, so reaching out with care and understanding can make a significant difference. 1. Now, let's talk about sign number 5: changes in sleep patterns. 2. Mental health issues often disrupt our sleep. 1. You might find it difficult to fall asleep, stay asleep, or experience restorative sleep. 1. These disruptions can happen due to racing thoughts, anxiety, or nightmares. Insomnia, where you struggle to sleep, and excessive sleep, where you find yourself sleeping too much, can both be signs of underlying mental health concerns. 2. They can leave you feeling fatigued and affect your mood and cognitive function. 1. Sleep is essential for mental well-being. 1. It's during sleep that our brains process emotions and recharge. 2. Ignoring changes in sleep patterns can exacerbate mental health issues, making it even more crucial to address them. 1. Moving on to sign number 6: appetite and weight changes. 1. Mental health issues can significantly influence our eating habits. 1. You might lose interest in food or, conversely, use food as a way to cope with emotions. 1. Unexplained weight loss or gain can be red flags. 1. It can indicate underlying issues like depression, anxiety, or even eating disorders. 1. These are serious conditions that require professional help. Sign number 7. Substance abuse. Sometimes, when people are struggling with their mental health, they turn to substances like drugs or alcohol as a way to cope with emotional pain. Substance abuse is often intertwined with underlying mental health issues. It can be a way to self-medicate and temporarily relieve emotional distress. 1. However, it's a harmful and unsustainable coping mechanism. 2. Sign number 8. Difficulty concentrating. 3. Mental health issues can make it challenging to focus on tasks or sustain attention. 4. You might find your mind wandering, forget important details, or struggle with decision-making. 5. Conditions like depression can bring about cognitive symptoms, often referred to as brain fog. These symptoms can affect memory, problem-solving, and overall mental clarity. The impact of difficulty concentrating isn't limited to personal life. It can spill over into work or daily responsibilities. 1. You might struggle to meet deadlines, make errors, or feel overwhelmed by even simple tasks, examples like headaches, stomachaches, and fatigue. 2. Mental health issues can significantly impair focus and concentration, making it challenging to perform tasks, work, or even engage in daily activities. 3. Here's an explanation of how various mental health issues can impact focus and concentration. 5. Racing thoughts. Anxiety often leads to a whirlwind of racing thoughts, worries, and concerns. 6. These thoughts can be intrusive and overwhelming, making it difficult to concentrate on anything else. 7. Hypervigilance. Individuals with anxiety may become hyper-alert to potential threats or dangers in their environment. This constant vigilance can divert attention away from tasks and make it hard to focus. Depression. 1. Lack of energy. Depression is often accompanied by extreme fatigue and a general lack of energy. 2. This physical and emotional exhaustion can make it challenging to muster the mental stamina required for sustained concentration. 3. Difficulty initiating tasks. People with depression may struggle to initiate tasks or activities. 4. Even simple tasks can feel overwhelming, leading to procrastination and poor focus. 5. Attention deficit hyperactivity disorder, ADHD. 6. Inattention. ADHD is characterized by symptoms of inattention, which can lead to difficulties staying focused on tasks, following through with instructions, and organizing thoughts. 7. Hyperactivity and impulsivity. The hyperactive and impulsive aspects of ADHD can also interfere with concentration, as individuals may impulsively act on distractions or have difficulty sitting still and focusing. 8. Post-traumatic stress disorder, PTSD. 9. Intrusive thoughts. Individuals with PTSD often experience intrusive and distressing thoughts related to traumatic events. 10. These thoughts can intrude upon daily activities, disrupting focus. Hypervigilance. Similar to anxiety, hypervigilance in PTSD can divert attention away from tasks as individuals remain on high alert for potential threats. Bipolar disorder. Manic episodes. During manic episodes, individuals with bipolar disorder may experience racing thoughts, increased energy, and impulsivity. 1. While these periods can enhance creativity, they can also disrupt focused attention. 2. Stress. 3. Overwhelm. Stress, whether from work, relationships, or other life events, can overwhelm the mind. 4. When stressors are high, individuals may find it challenging to concentrate on anything other than their sources of stress. 5. Substance abuse. 6. Impaired cognitive function. Substance abuse can impair cognitive function, including attention and concentration. 7. This can persist even during periods of sobriety and recovery. 8. Medication side effects. Some medications prescribed for mental health conditions can have side effects that impact focus and concentration. It's essential to discuss these effects with a healthcare provider. Addressing impaired focus and concentration due to mental health issues often involves a combination of therapeutic interventions, lifestyle adjustments, and, in some cases, medication. Lifestyle modifications, including regular exercise, a balanced diet, and adequate sleep, can also support better concentration. The impact of impaired focus and concentration due to mental health issues on work and daily tasks can be significant and wide-ranging. Miscommunication, missed meetings, or an inability to engage in workplace social dynamics may strain professional relationships. Decline in job satisfaction. As work becomes more challenging due to impaired focus, job satisfaction often declines. People may feel unfulfilled in their roles, which can contribute to feelings of hopelessness and depression. Daily life impact. Household tasks. Everyday household chores and responsibilities, such as cleaning, cooking, and managing finances, can become overwhelming. Basic self-care may also be neglected. Social interactions. Impaired focus and concentration can affect personal relationships. People may struggle to engage in meaningful conversations or participate in social activities they once enjoyed, leading to isolation and loneliness. Education. For students, concentration difficulties can lead to poor academic performance. Keeping up with coursework, studying effectively, and completing assignments may all become daunting tasks. Healthcare. Managing one's healthcare, including scheduling appointments, understanding medical advice, and adhering to treatment plans, can be challenging for individuals with concentration issues. Financial management. Impaired focus can affect financial decision-making and budgeting. Bills may be forgotten or mismanaged, leading to financial stress. Safety concerns. Inattentiveness can lead to safety concerns, such as forgetfulness that may result in accidents or missed important details in critical situations. Overall quality of life. Cumulatively, the impact of impaired focus on daily tasks can erode an individual's overall quality of life. Feelings of frustration, inadequacy, and a sense of being overwhelmed can contribute to mental health issues, creating a vicious cycle. It's essential for individuals experiencing impaired focus and concentration due to mental health issues to seek appropriate treatment and support. This may involve therapy, medication, lifestyle changes, and workplace accommodations. With proper care and strategies, many people can regain their ability to focus and effectively manage daily tasks, ultimately improving their well-being and quality of life. Sign number 9. Physical symptoms with no medical explanation. Mental distress can indeed manifest as physical symptoms, a phenomenon often referred to as psychosomatic symptoms. These physical symptoms are real and can significantly impact a person's well-being. Here's an explanation of how mental distress can manifest as physical symptoms. Stress response. When a person experiences stress, whether it's due to work pressures, relationship issues, financial worries, or other factors, their body activates the fight or flight response. This physiological response is designed to prepare the body to deal with a perceived threat. It involves the release of stress hormones like cortisol and adrenaline, which can have various physical effects. Muscle tension. Stress and anxiety often lead to muscle tension. The muscles contract and tighten in response to stress, which can result in physical discomfort, pain, and even headaches. Chronic muscle tension can lead to conditions like tension-type headaches or temporomandibular joint (TMJ) disorder. Digestive problems. Mental distress can affect the digestive system. Stress and anxiety can lead to changes in digestive processes, including increased stomach acid production and altered gut motility. This can result in symptoms like heartburn, indigestion, irritable bowel syndrome, IBS, or even stomach ulcers. Cardiovascular effects. Prolonged stress and anxiety can affect the cardiovascular system. Stress hormones can lead to an increased heart rate and blood pressure, potentially contributing to cardiovascular conditions over time. Respiratory issues. Anxiety and panic attacks often involve rapid, shallow breathing, which can lead to symptoms like shortness of breath, chest tightness, and hyperventilation. These symptoms can mimic those of respiratory disorders. Immune system suppression. Chronic stress can suppress the immune system, making individuals more susceptible to illnesses. They might experience frequent colds, infections, or other health issues. Skin problems. Skin conditions like eczema, psoriasis, and hives can be exacerbated by stress. Additionally, stress-related behaviors such as scratching or picking at the skin can worsen these conditions. Sleep disturbances. Mental distress can lead to sleep problems, including insomnia. Sleep deprivation can, in turn, result in physical symptoms such as fatigue, weakened immune function, and impaired cognitive abilities. Pain sensation. Mental distress can influence the perception of pain. It may make individuals more sensitive to physical sensations, potentially exacerbating pre-existing pain conditions or causing unexplained pain. Cognitive impairment. Mental distress can affect cognitive function, leading to difficulties with memory, concentration, and decision-making. This can have practical consequences in daily life and work. It's essential to recognize that these physical symptoms are not imagined or all in the head. They are real and can significantly impact a person's quality of life. Addressing mental distress and its physical manifestations often requires a holistic approach that encompasses mental health care, stress management, and sometimes medical treatment for specific physical symptoms. Additionally, seeking support from mental health professionals can help individuals better understand and manage the mind-body connection. Sometimes, mental distress can manifest in the body, leading to unexplained physical symptoms. You might experience headaches, stomach aches, muscle tension, or fatigue. These physical symptoms can be quite real, but they often have no clear medical cause. Instead, they're a manifestation of the mind-body connection, showing how mental health can influence our physical well-being. The mind-body connection refers to the intricate relationship between a person's mental and emotional state, their mind, and their physical well-being, their body. This connection highlights that the mind and body are not separate entities but function as an integrated system, each affecting the other in profound ways. Here's a more detailed explanation of the mind-body connection. Emotions and physical health. Emotions, such as stress, anxiety, and happiness, can have a direct impact on physical health. For example, chronic stress can lead to physical health issues like high blood pressure, digestive problems, and a weakened immune system. Stress response. When a person experiences stress or perceives a threat, the brain activates the body's fight or flight response. This triggers the release of stress hormones like cortisol and adrenaline, which can have both immediate and long-term effects on various bodily systems. Psychosomatic symptoms. The mind-body connection can manifest in psychosomatic symptoms, where emotional or psychological factors contribute to physical symptoms. For instance, stress or anxiety can lead to headaches, muscle tension, or stomach aches without any apparent physical cause. Placebo effect. The mind-body connection is evident in the placebo effect, where a person's belief in the effectiveness of a treatment can lead to real improvements in their physical health. This demonstrates the influence of mental attitudes on physical outcomes. Mind-body therapies. Mind-body therapies, such as meditation, yoga, and mindfulness, focus on harnessing the connection between mental and physical well-being for therapeutic purposes. These practices have been shown to reduce stress, improve immune function, and enhance overall health. Chronic illness. Chronic illnesses like depression, anxiety, and post-traumatic stress disorder, PTSD, can have profound effects on the body. They may increase the risk of cardiovascular disease, weaken the immune system, and lead to a range of physical symptoms. Resilience. Conversely, a positive mental and emotional state can enhance physical resilience. Optimism, social support, and a sense of purpose have been associated with better health outcomes and increased longevity. Holistic health. The mind-body connection aligns with the concept of holistic health, which emphasizes treating the whole person rather than just addressing physical symptoms. Holistic approaches recognize that emotional and psychological factors play a vital role in overall well-being. The mind-body connection underscores the profound ways in which our mental and emotional states influence our physical health and vice versa. Sign number 10 is perhaps the most critical of all: thoughts of self-harm or suicide. These thoughts are emergencies, and they should be treated as such. Reach out to a mental health professional, a crisis hotline, or emergency services immediately. You don't have to face this alone. Please, if you or someone you know is struggling, reach out. There is support available, and there is hope. These thoughts are a clear sign of a mental health crisis. Ignoring them can result in the situation worsening rapidly, potentially leading to irreversible harm. Timely intervention can prevent tragedies. Many individuals who receive appropriate help can recover from their mental health challenges and go on to live fulfilling lives. We encourage friends, family members, and communities to be more vigilant and supportive, potentially saving lives. If you or someone you know experiences these thoughts, it's crucial not to ignore them. Thoughts of self-harm or suicide indicate that an individual is in immediate danger. These thoughts are not to be taken lightly, as they can lead to life-threatening actions. If you find this information helpful, please consider liking, sharing, and subscribing to our channel.